Have you ever noticed how the facts of a fields crowd consist solely of the factually adverse? Take the person responding to today, the UK's answer to Blair White, Rose of Dawn. Rose of Dawn is a YouTuber who has built a career for herself by lying about trans issues at every possible opportunity, all as part of an attempt to rewrite reality as to not offend the right-wing sensitivities of her audience. And I'll get to supplying evidence of all this in a second, but before I can do that, I just need to give a content warning for the following: transphobia, transmedicalism, ableism, sex work, gaslighting, child abuse, medical procedures, cancer, rape and sexual assault, police violence, torture, self-harm, and suicide. What can I say? It's a Rose of Dawn video. This video has been coming for a while. I didn't know when or on what topic. All I knew was that I was going to have to respond to her rampant dishonesty at some point. As it happened, Rose of Dawn uploaded a video talking about the High Court of England and Wales ruling on Tavistock and Portman, a Gender Identity Development Service, or GIDS, operating under the NHS. Now, there's a lot to cover here, so I'm just going to allow Dawn to present the court case before pointing out a few key details she's chosen not to tell you.
But this all concerns a particular court case brought up by Keira Bell. Now, a lot of my American viewers might not know who she is, but Keira Bell is a detransitioned woman. So when she was a teenager, she went through the Tavistock and Portman NHS clinic in the UK. She was prescribed puberty blockers and then went on to cross-sex hormones and eventually had actual trans surgeries. Eventually she came to the conclusion that transitioning really wasn't for her, and so started the process of detransitioning. Now she is going to live with the impact of that transition for the rest of her life, and she felt that the trans clinic didn't really do their job in making her aware of what it was she was signing up to. So she joined forces with an unnamed mother of a trans child and took Tavistock and Portman to court.
So the first major lie by omission comes in how Dawn presents Keira Bell as a teenager who is referred to Tavistock and Portman. The way this is presented makes it sound like her case has relevance to whether minors can give informed consent in regards to puberty blockers. Now I should probably clarify for my non-UK audience that the age of full medical consent here in the UK is 16. So what's the problem? Well, Keira Bell was 16 when she was first placed on puberty blockers, 17 when she went on HRT, and 20 when she had a double mastectomy. Keira Bell was over the age of full medical consent when she underwent treatment. Yet, when Rose of Dawn says teenager, she's exploiting a very specific cultural understanding that equates teenager and minor, actively leading the audience to conclude that Bell was under 16 when she began treatment. I mean, imagine if schools asked for more money to tackle teenage drinking, claiming that 20% of teenagers regularly consume alcohol. Well, what if you later discovered that the results had included 18 and 19-year-olds, people above the UK age for drinking? You'd likely said you'd been misled, and quite rightfully so. Similarly, one is likely to conclude that the unnamed mother of the trans child has experience with Tavistock and Portman in order to file such a case. Except that's not true. As stated in a BBC article covering the case, quote, "The second claimant, known only as Mrs. A, is the mother of a 15-year-old girl with autism, who is awaiting treatment at the clinic." End quote. Keep in mind that the average waiting time to be seen by the NHS on gender-related issues is between 33 and 36 months. So the child has not received treatment, meaning that none of the claimants in this case actually relate to the ruling. Meanwhile, the court actively rejected offers from people who had or were actually transitioning under Gillick competence to speak as part of the case. But it doesn't end just there. Dawn has also left out Keira Bell's motives. You see, Keira Bell's not out there with a genuine concern in regards to trans youth making a hasty decision. She's out there with the hopes to eradicate us, as seen in the following, which comes from Bell's official press release. Quote, "The fight is not yet over. I would like to personally call on professionals and clinicians to create better mental health services and models to help those dealing with gender dysphoria to reconcile with their sex." End quote. This is not about children referred to GIDSs, this is about children suffering gender dysphoria. Keira Bell has called for conversion therapy. That is what folk are threatening when they talk about helping people reconcile with their sex. Conversion therapy refers to a range of pseudoscientific methods meant to turn a queer person allosexual, cis, or straight. This is in spite of the fact that said methods increase attempted suicide in trans youth from 5% to 57% within the last year, all whilst never having been shown to actually change a person's gender. It is, put rather simply, torture marketed as therapy. What's more is, the effects of gender identity conversion efforts, or GICEs, are long-lasting, with researchers at JAMA Psychiatry reporting that, quote, exposure to GICE before age 10 years was significantly associated with several measures of suicidality, including lifetime suicide attempts, end quote. This is why medical institutions such as the UK Council for Psychotherapy, the American Academy of Pediatrics, the American Medical Association, and the US Substance Abuse and Mental Health Service Administration all agree that gender affirmation is the only ethical course of action. Though, to be fair, Dawn does acknowledge the horrors of GICEs in her video, but she pretends like said practices are not relevant to Keira Bell's case, despite an admission from the woman herself. In fact, stripping away Gillick competence and the bodily autonomy of trans people in general is only the first step in Bell's plan, which leads us rather nicely into the next segment,
where the judge actually found in the claimant's favour. And initially, I was almost surprised at this. I mean, a lot of our institutions are being co-opted by the woke orthodoxy, but in this instance, sanity actually won. And there are some very good reasons for that. First and foremost, the case wasn't discussing whether or not cross-sex hormones or transitioning a young person is a real beneficial medical treatment. It did not comment on that at all. What it discussed was a concept known as Gillick competence, which sounds a little bit strange, but in a nutshell, Gillick competence is just to make sure that a person under the age of 16 is aware of what the implications of a medical treatment could be, and they need to be considered Gillick competent in order to receive said treatment.
Except the case wasn't strictly about under 16s, the case also ruled against 16 and 17-year-old trans folk having the same standard of bodily autonomy as cis people. As mentioned earlier, 16 is a legal age of full medical autonomy in the UK. That means you are assumed to be able to give medical consent, and the only way to remove that is for others, such as your doctor or family, to prove via evidence of court that you lack the faculties to make such an informed decision. Note where the onus rests. It rests with the people attempting to deny a person their right to consent to treatment. Compare that to Section 6 of the Judiciary Summary, which reads, quote, in respect of young persons aged 16 and over, the legal position is that there is a statutory presumption that they have the ability to consent to medical treatment. Given the long-term consequences of the clinical intervention at issue in this case, and given that the treatment is as yet innovative and experimental, the court recognized that clinicians may well regard these as cases where the authorization of the court should be sought before starting treatment with puberty-blocking drugs. End quote. This is another reason as to why noting Keira Bell's age is so important. Now, Section 1D of the Amendments to Service Specification for Gender Identity Development Service for Children and Adolescents, published by the NHS, which became effective as of the 1st of December of 2020, noted one of the conditions in which a doctor would have to seek court permission. Said section reads as, quote, for patients who are aged 16 to 17 years, the legal position is different. So long as the patient has mental capacity and the lead clinician considers the treatment to be in the patient's best interest and there is no parental dispute about the intervention, treatment may proceed. However, the High Court noted the long-lasting consequences for interventions which the court described as experimental. In cases where a 16 or 17-year-old is receiving puberty blockers and the administration of cross-sex hormones is being considered, and in cases where a young person aged 16 or 17 years is already receiving cross-sex hormones with or without puberty blockers, with a view of this continuing, the patient's lead clinician is therefore required to review every such patient's individual circumstances and to consider an application to the court through the NHS provider for final determination of that individual's needs if there is a doubt about the patient's best interests." End quote. Notice how parents have to simply dispute their child's gender to derail their treatment, which is the only time Gillick competence comes into effect. What all this has effectively done is designate trans folk second-class citizens. Compare it to the Sexual Offences Act of 1967 and the Criminal Justice and Public Order Act of 1994, designating gay and bisexual people as lesser, lacking the same rights and liberties as heterosexual folk, by setting the age of same-gender sexual consent at 21 and 18 respectively. That's what this ruling is to trans folk. However, unlike those laws which took us from same-gender intercourse being a criminal offence to full and equal legalisation with the passing of the Sexual Offences Amendment Act of 2000, this court ruling has stripped away a set of rights trans folk had previously held, not just for under 16s, but for 16 and 17-year-olds as well. Which is not something you'll find out by watching Dawn's video, especially segments like these.
Are kids honestly aware of what it is they're going through? And I always maintained this position that 16 is the reasonable age to do so. I have always maintained that I think that 16 is the reasonable age to start a transition. And if anything, this judgment really it kind of goes into what my beliefs already were, being completely honest.
Again, this is not what the court has ruled. So she's either knowingly lying about having studied the court case, or is knowingly lying about the case itself. Now earlier I said the onus rests on the doctor and the patient, however, the truth of the matter is, it will come to rest solely on the patient. Why? The Tories are gutting the NHS, which was paid for by the taxpayers, carving it up and selling it off. It is incredibly underfunded, especially gender services. That's why we have patient wait times that average between 33 and 36 months for a first appointment. That's 3 years. So the idea that the NHS is going to fund a whole new system which will allow doctors to get court approval for their patients to go on puberty blockers and HRT is ridiculous. Said cost will ultimately be shifted to the patient, patients who, by the way, belong to a demographic which is at high risk of unemployment, poverty, and homelessness. The harm this poses is more than the immediate psychological torment brought about by body dysphoria. If they're in full-time education, they may have to abandon that just so they can earn enough to receive the treatment they need, putting their entire life on hold. On top of this, financial desperation will breed risk-taking behaviour such as sex work. Just to be clear, there is nothing inherently wrong with sex work, but under the current UK system, this is likely to result in further harm, such as an increased risk of sexual and police violence, which, in turn, results in an increased prevalence of mental health problems like PTSD, which require years of therapy, with the NHS only covering a handful of sessions at most. And make no mistake, minors will be forced to engage in such behaviours as well. Homeless youth are already at a higher risk of sexual exploitation, and this ruling adds to that. Whether they intend to fight their parents in court or go private, this ruling adds another reason to sell their body to predators to try and make money. It's a horrific fact that there are people out there, mostly cis men, who patrol the streets looking for homeless minors to abuse under the promise of a roof or money, and this ruling will add to the power they have. That's a ruling Dawn is celebrating. There's a whole cascade of effects this will have on the current generation of trans youth. So with Dawn's lies by omittance out of the way, we can finally move on to address the rest of our arguments in the true context of the court case, starting with Gillick competence. Now, Here's a little reminder of how Dawn summarized Gillick competence at the start of her video.
What it discussed was a concept known as Gillick competence, which sounds a little bit strange, but in a nutshell, Gillick competence is just to make sure that a person under the age of 16 is aware of what the implications of a medical treatment could be, and they need to be considered Gillick competent in order to receive said treatment.
And you know what? That isn't such a bad summary. It's just a shame that Dawn completely ignores it when she goes on a tirade against said standard, as seen in sections like this one.
There are no studies saying that a person under the age of everyone under the age of 16 knows it. Of course, there might be some, but these are all individual cases.
Note how Dawn caught herself giving the actual definition of Gillick competence, realised she couldn't make a reasonable argument against said standard, so changed it from a person under the age of 16 to everyone under the age of 16. That is not what Gillick competence is. Gillick competence, by very definition, acts on a case-by-case basis. So the whole everyone under the age of 16 is Dawn's invention. This is not a mistake based in ignorance, which would still be her lying about having researched the topic. This is very clearly her lying with full knowledge of the fact that what she is saying isn't true. All because admitting that fact would upset her far-right audience. Gillick competence has been a medical standard since 1985, after a court case between Victoria Gillick and the Department of Health and Social Care. You see, the DHSC had advised doctors on the prescription of contraception to under 16s, giving them full permission to do so at their own discretion, without requiring parental consent. Victoria Gillick campaigned against this and ultimately took the DHSC to court. It was there that she argued that, since the minors prescribed contraception by their doctors were likely to go on to have sex, said doctors were encouraging sex with a minor, opening them up to lawsuit. Now, she lost her case in the High Court, but won the Court of Appeal before the case was presented before the House of Lords. And it's here that it was decided that a medical minor could consent to medical treatment if and when they understood it. The standard, as summarised by Lord Scarman in 1985, reads as quote, "As a matter of law, the parental right to determine whether or not their minor child below the age of 16 will have medical treatment terminates if and when the child achieves sufficient understanding and intelligence to understand fully what is proposed." End quote. And since 1985 right up to December of 2020, Gillick competence has always existed at the doctor's discretion. Why? Well, since they have an understanding of both the medicine and their patient, they're the one best equipped to make such a call. This case destroyed that standard, taking the power to decide Gillick competence away from trained professionals and placing it in the hands of judges with exactly zero medical training or history with the patient. The impact of which is, like earlier, declaring trans minors second-class citizens with less rights than their peers. And the fact that Dawn first lies about what Gillick competence entails before appropriating it shows that said standard makes sense to a lot of people. So much so that she couldn't attack it directly. Instead, she had to pretend like Gillick competence was a blanket deal. The irony of which comes in the fact that the court ruling is a blanket deal, barring puberty blockers for under 16s without parental consent and holding 16 and 17-year-old trans folk to the unprecedented standard of justifying their ability to consent. Though these aren't Dawn's only lies. Just take this section discussing the medical consensus on puberty blockers and informed consent.
There is no scientific consensus that says a person under the age of 16 is competent enough in the eyes of the law to understand what it is that they're going through. Anyone who says that is lying, first and foremost.
Actually, it just means they have a grip on modern medicine. Keeping it local and recent, the British Medical Association, a prestigious scientific institution consisting of over 159,000 doctors and 19,000 medical students, held its annual conference last year. This was on the 19th of September, as the court case was ongoing, and it was during that conference that the Northwest Regional Council forwarded a motion that stated the following. quote, that this meeting affirms the rights of transgender and non-binary individuals to access healthcare and live their lives with dignity, including having their identity respected, and calls upon the government to 1. Allow transgender and non-binary individuals to gain legal recognition of their gender by witnessed sworn statement. 2. Ensure that under 18s are able to access healthcare in line with existing principles of consent established by UK case law and guidelines published by the public bodies which set the standards for healthcare. 3. Enable trans people to receive healthcare in settings appropriate to their gender identity. 4. Ensure trans healthcare workers are able to access facilities appropriate to the gender they identify as. 5. Ensure trans people are able to access gendered spaces in line with the gender they identify as. End quote. Pay special attention to point 2, that the government must, quote, ensure that under 18s are able to access healthcare in line with existing principles of consent established by UK case law and guidelines published by the public bodies which set the standards for healthcare. End quote. Now, during the debate, Dr. Allport would make it clear that this motion was related to the ongoing High Court case, with a summary of the discussion stating that, quote, Dr. Allport also said the government was planning to ban puberty blockers and hormones for under 18s with gender dysphoria, end quote. So in spite of that being made absolutely clear, said motion passed in full, without amendment, meaning that the official stance of the UK's medical union is that in support of medical transitioning for under 18s, in line with established case law, such as that on Gillick Competence. So just how much does a teen have to understand when it comes to puberty blockers? Well, not a whole lot. The blockers simply stop puberty somewhere between Tanner stages 2 and 3, typically at 12 years of age. Once removed, puberty resumes, working with whatever hormones are in the body, whether they be the body's own or those introduced via HRT. So the expression puberty blockers are fully reversible is a bit misleading since they don't actually change anything about the body, they just pause everything. This allows the person in question up to 4 additional years to decide whether HRT or surgery is right for them, which places most people on puberty blockers beyond 16, the age of full medical consent. I'd also like to note that part of the reason early puberty is allowed to take place is because the parts of the brain responsible for gender and sexuality are among the earliest parts to develop. That means that by allowing some degree of puberty to take place, we can be pretty certain that the parts of the brain responsible for developing that understanding are fully formed, even if a person may not have the language to describe themselves in line with social groups. That can come later. Now I know what's coming, but what about the side effects and the risk involved with puberty blockers? After all, Dawn asserted the following.
But also is ignoring the potential health risks that involve puberty blockers because there's simply not enough of a study to really determine what the long-term effects on this are. And again, this was brought up in the court case.
Fact is, these speculations were discussed at that conference, with the summary noting that Dr. Angela Dixon argued, quote, the treatment of children and young people with gender dysphoria was a matter of debate, but that puberty blockers and hormone reassignment could cause irreversible changes to the body, including fertility, end quote. These claims were discussed, assessed, and found to be in want of any evidence. Because the reality is, we have been using puberty blockers on cis children for decades. They were actually developed to help reduce the psychological distress caused by precocious or early onset puberty. Doctors simply realized that they could be used in the same manner to help trans children, giving them more time to learn about HRT and surgery to ensure that they made the best informed decision possible. So to claim that there are unknown risks surrounding puberty blockers at this point without substantial evidence to support that assertion is akin to claiming that vaccines are unsafe because they might cause autism. Dawn and others didn't raise issue with these medications when they were used on cis children, showing their real issue to be politically motivated rather than scientifically and ethically grounded. And people like Rosa Dawn need to get over it. Thankfully, the medical consensus does not give a crap about the hollow speculations of a scientifically illiterate YouTuber. which is why the British Medical Association supports the rights of 16 and 17-year-old trans folk to have full medical consent like their cis peers, along with the doctor's ability to decide Gillick competence for under 16s. To assert there is no medical consensus on this is not just a lie, it is a blatant lie. There are 159,000 doctors worth a consensus. And the British Medical Association is not alone. Again, the UK Council for Psychotherapy, the American Academy of Pediatrics, the American Medical Association, and the US Substance Abuse and Mental Health Support Service Administration all agree that affirmation is the only ethical course of action. And that includes supporting a trans teen's right to give medical consent in line with pre-existing case law, such as Gillick competence. Though, speaking of scientific illiteracy, I think it's time we tackle the ignorance that rests at the heart of this case and is shared by Rosa Dawn, and that is the conflation of correlation and causation.
Now, in this instance, when it comes to transitioning and puberty blockers, the court found that there was an incredibly high chance of the puberty blockers going on to cross-sex hormones. In fact, studies afterwards have shown that this prevalence is incredibly high. And so therefore, just simply knowing the impact of puberty blockers on a child is not enough to attain that competence. You also need to have the understanding of what the rest of your transition will entail. And I think that's completely reasonable, because when you start a transition, really you need to be 100% sure. You need to know everything which is going to be happening, and you need to be 100% okay with it, because it is a huge life-changing commitment. Can somebody under the age of 16 really be reasonably aware of issues pertaining to fertility when they're older, or their sex life, or how they might be treated, or the actual health implications of even going on something like puberty blockers? There are so many different concepts to really take into account. It's very difficult for even an adult, I would argue, to be 100% aware of exactly what it is that they are signing up for. And when it comes to a 16-year-old, again, I don't think that they are necessarily going to fully acknowledge everything which they're going to go through.
Except that's not how science, and by extension medicine, operate. The fact that almost all of trans-identified youth placed on puberty blockers later go on to further medical transition is only evidence that this is what happens. It's not evidence that being put on puberty blockers causes a teen to want further medical treatment. So to pretend like that is the case, that puberty blockers are transing children, and therefore anyone who goes on blockers needs to have a full understanding of both HRT and surgery, is dishonest to the very core. It also ignores a large piece of the evidence which, rather ironically, Dawn accuses us of ignoring in her video.
And a lot of this also ignores the general desistance that a lot of trans-labelled children pre-puberty actually go through. In fact, a lot of the studies that Dr. Deborah So has looked into have seen up to between 60 and 90% of all labelled trans children actually desisting by the time they hit puberty.
And you know what? It's true. On average, what Dawn has referred to as trans-labelled children have a desistance rate of around 84.2%. Now the trick here boils down to what Dawn is referring to as a trans-labelled child, because the studies don't use that. Instead, they use gender dysphoria, with the title being Factors Associated with Desistance and Persistence of Childhood Gender Dysphoria, a quantitative follow-up study. Except even this is somewhat misleading. Why? Well, because of how the study qualified gender dysphoria. The researchers did not qualify said term through a clinical diagnosis of the condition as defined in the DSM-5. No. Instead, all that was required for a child to be noted as such was for them to be referred to a Gender Identity Development Service, GIDSs that take the gender affirmative approach, like Tavistock and Portman. Now, the vast majority of these children refer to said services by untrained adults such as parents or teachers, or by trained professionals who lack sufficient knowledge of the specific topic, so your GP or school counsellor. Given that these people lack sufficient knowledge to figure out whether a child is trans or not, referring to these children as trans-labelled or gender dysphoric is rather interesting. Therefore, from this point forward, I shall refer to them as gender variant youth, since that is why the vast majority are referred to GIDSs. An adult sees a child acting outside of classical gender roles, they worry they may be trans, so they send them for assessment. And in 84.2% of cases, that child receives no further support since said therapist recognizes said behavior as normal childhood exploration. For you see, the same researchers who carried out their work into the racist assistance also looked into the factors involved with their article titled Desisting and Persisting Gender Dysphoria After Childhood, a Qualitative Follow-up Study. And, as they touched upon in the previous study, they went into detail on how the desisters and persisters showed key underlying differences, such as in motive, that therapists could use to pretty accurately figure out which children were likely to develop clinical gender dysphoria and would therefore benefit the most from further support. So there's a selection process involved very early on when it comes to who does and who does not get to go on puberty blockers. And that's something Dawn has opted to ignore. In science, we call this the survivorship bias, a logical error of concentrating on the people or things that made it past some selection process and overlooking those that did not. 100% of youth put on puberty blockers go on to further medical transition. Sounds ominous, almost conspiratorial. That's until we acknowledge the facts that said 100% only accounts for less than 15.8% of all youth referred to GIDSs. And I say less because GIDSs offer more support than simple medical transitioning. So there will be those who receive support for things such as social transitioning who do not go on to puberty blockers. To put things in an analogy, the initial assessment is a lot like a cancer screening. If the risk of a false positive for cancer was smaller than 0.01%. Now, those found to have a tumor undergo surgery, which, unlike puberty blockers, actually carries with it substantial risk. However, because 99.99% of all people put under the knife are found to have a tumor, Rose of Dawn and the Supreme Court of England and Wales come along and declare that surgery to remove a tumor causes cancer. That is quite literally what they are doing in regards to puberty blockers and gender dysphoria. And this is where we come to see the danger behind conflating correlation and causation. Dawn looked at some numbers, stripped them of all Verstehen, all qualitative understanding, and used that to forward her baseless accusations surrounding the effects of puberty blockers and how they apparently trans children. Yet, when we look at the actual evidence, we find a much more empirically grounded explanation. That gender specialists know what they're doing. And it really is a travesty, because having such a high persistence rate would be taken as cause for celebration in any just world. 100% of youth put on puberty blockers persisting onto HRT and surgery as they come of age means not a single person was put on blockers without reason. For comparison, according to 138 separate studies, the satisfaction rate for knee surgery is around 66.3%. So if anything, we need to assess whether GIDSs are being too reserved with the prescription of blockers. And this isn't the only instance in which Dawn does this. Take, for example, this section and actually think about what she's saying.
Now, activists might point to the amount of people who are going on puberty blockers and then basically going on to cross-sex hormones as proof that this treatment is 100% worth it and all the clinicians are right all the time. However, there are many problems with this. First and foremost, in the court case, it came out that the Tavistock Clinic actually considered basically everyone who went on puberty blockers to be 100% aware of what it was they were signing up to. In fact, they didn't think that this question ever really arose. That's a little bit concerning. That's saying that of the hundreds of people who have gone through the clinic over the last 10 years, everyone apparently knew what they were doing. They didn't have any real notable instances of them thinking, hold on, this person might not necessarily know what they're signing up for when it's such big life-changing treatment. I don't get how that's statistically possible.
Know how Dawn stated that?
The Tavistock Clinic actually considered basically everyone who went on puberty blockers to be 100% aware of what it was they were signing up to.
All that actually is her saying that the clinic didn't prescribe puberty blockers to anyone who couldn't give informed consent. It wasn't everyone referred for puberty blockers, but everyone put on them. Which, no shit. That's what they do. That is literally their job. Dawn is accusing Tavistock of making sure nobody is randomly put on blockers. Again, ignoring the survivorship bias. Now, as funny as that is, I saw she put up a quote from the case, and so I thought, maybe she'd misspoke. Maybe she had meant people referred for blockers. Except the quote says the exact opposite, detailing how, in such a case, a patient would be denied said medication as their doctor worked alongside them to help them reach Gillick competence, noting that if they couldn't do so in time, the patient would be discharged as they reached the age of full medical consent, which again is part of the doctor's job. They are quite literally paid to explain the details of a medication or procedure to their patient. So this whole narrative that Dawn has invented about blockers leading trans youth onto HRT and surgery, it has no grounding in reality. It's pure speculation. Not only do they lack a causal method to explain how blockers apparently trans youth, but they lack the statistical justification to speculate on such a connection. Once we actually read the research Dawn is pretending to have looked into. But that sure as hell isn't going to stop her from lying about the affirmation process, as seen here.
And that seems to be completely unquestioned. Again, when you're dealing with the affirmation model, is that really the right thing? Do you really think that any of these kids are going to be, having any kind of discussion about, are you sure this is the right thing that you want to do? I mean, I'm not convinced. I'm not convinced that that's the point.
Yet, as we just seen, the vast majority of people referred to such clinics receive no further support since their therapists don't think they need it. Problem is, Dawn has so far gone down this rabbit hole that she takes things a step further, crying about how clinicians are apparently terrified of some sort of trans-orthodoxy, as seen in these 3 clips.
Put yourself in the shoes of these clinicians. They could potentially risk their jobs, as many of us do, simply by speaking out against this orthodoxy. But when you're dealing with all of these kind of bizarre takes, all of this, calling for people's heads, are you really surprised that clinicians aren't going to be challenging their patients, especially kids, when it comes to this? Probably a lot of them are terrified. When we just have this affirmation model where everyone who says that they are a gender has to be accepted, then I get very, very skeptical, and I'm not convinced that actual proper professionals are able to do their job competently. I don't think that that's happening because of the amount of pressure that's being put on them. And in fact, in Deborah So's book, she talks about just that. There's so much activist pressure on these people, and hell, even former Tavistock staff themselves have said so. There are real issues here, and the fact that trans activists want to simply paint this as yet another version of oppression that everyone is going through, when they can't even be honest enough to simply say, actually, you know what, maybe we might need to be skeptical about 14-year-old Jimmy, who might also be Tammy and also Bob at the same time, because they've decided they are trigender. If they're not going to be skeptical about any kind of transition, they shouldn't then expect everyone to be on board when you're giving kids hormone blockers. What should we do to meet up then? Well, scrap the affirmation model. Actually put in some skepticism. Don't accuse everyone who's disagreeing with you of being a bigot or wanting to convert people into not being trans. Actually let people explore it. And when we say explore it, we don't just mean say, yes, of course, Timmy, you're actually Tammy. What we mean is maybe they are, maybe they're not. Maybe we should be giving them actual mental health care. Because again, when it comes to the argument about suicides, none of us are ever saying that these kids should not have treatment. What we're saying is maybe putting them on puberty blockers when we really don't know enough about the future is not the right step.
Except that's exactly what Keira Bell is saying, and Dawn is trying to help her sell. Bell is publicly pushing for clinicians to begin conversion efforts on trans youth, and Dawn is covering for that with an abject lie. This is no longer a lie by omission, this is flat out disregard for the truth, and a dangerous one at that. As for the core point, the idea that gender variant youth aren't being questioned, that professionals are too afraid to take a stand, how does she explain the 84.2% desistance rate at these clinics? If they really were so terrified of the trans orthodoxy and what it might cost them, we'd expect a desistance rate closer to 0%. I mean, these children are quite literally handed over to these clinics. If they really wanted to, or felt that they had two trans children and such a thing were possible, they'd be in a prime position to do so. But they don't, because Dawn is talking out of her bloody ass as per usual. Dawn is also very clearly falling back on the ableist narrative surrounding dissociative identity disorder, along with its cultural association with the trans community, dating all the way back to Hitchcock's Psycho. Yes, some trans people can have multiple names. I used to go by two names back when I thought that giving people the option to misgender me would make them less likely to feel threatened by me. But a trigender person isn't usually three separate people. Though a trigender person with three separate alters is theoretically possible, all being trigender tells you is that they're someone with three genders. As for multiple names, well, that's something cis people do as well, for a variety of reasons, both emotional and pragmatic. Nicknames, pen names, stage names, cultural names, you name it. Yet Dawn presents the same thing when carried out by trans people as deviant, seemingly as part of an attempt to portray sections of the trans community as mentally ill and potentially dangerous, harming both communities in the process. Dawn is attempting to play on her viewer's emotions since she's unable to support her case on reasoned and evidence grounds. What's more is, Dawn is very clearly ignorant as to how DID manifests itself. Co-consciousness, i.e. having multiple alters active or fronting at any one time, is possible with training and preparation, but it is not an intrinsic feature of classical DID. One of the more distressing aspects of DID is the amnesia a lack of co-consciousness results in. When an alter moves back as another alter fronts, they're not there looking out as the fronting alter operates the body. They're effectively on pause or asleep until they confront again, at which point time has moved on. That's why therapists will actually teach co-consciousness as a tool that allows multiple alters to form memories simultaneously. So the idea of a child fronting three separate alters at the same time is a little detached from the neurodivergence Dawn is reaching for. I'd just like to pause to thank Glade Meadows for helping me write this section. I'd also suggest What is Co-Consciousness by Sarah K. Rees for those of you interested. Sadly, this is not the only element of psychology that Dawn is clearly unable to speak on, with therapy entering the crosshairs in sections like this.
They did an article on the kind of implications of conversion therapy, and they noted a couple of interesting phrases that, well, are a bit worrying. So, according to Gender GP, they mentioned some of the kind of tortures that people go through in this process, but then they also stated it's important to recognise not all conversion therapy is extreme, and gave a list of phrases you might hear, including, "You will grow out of it, it's just a phase. If you have a vagina, you are a girl. Boys don't wear dresses. You will bring shame on the family if you think like that. You shouldn't try and change how you were made. Are you sure you will feel like this? Do you think you'll pass as a woman? How is this different to simply being a lesbian? You shouldn't use puberty blockers to block your natural puberty. You shouldn't take hormones to change your external appearance. Your child will most likely grow out of this," and so on and so forth. A lot of these questions are ones I would expect a clinician to be asking. For example, just the idea that someone is going to go through a huge life-changing decision and you shouldn't even be asking them whether they are sure. That's effectively what this is saying. Any kind of questioning is tantamount to conversion therapy, and that's where this whole affirmation model comes in.
First of all, the one question Dawn's actually taking issue with is, quote, are you sure that you feel like this, end quote, not, quote, are you sure you will feel like this, end quote, as read out by Dawn. Note the present tense of the original question, because who the actual fuck is certain about how they'll feel in the future? As noted earlier, 34.7% of people who undergo knee surgery are not satisfied with the results. This argument can be used on any form of consent, and what's more is, it is used in certain contexts. The argument of post-abortion regret is a staple of anti-abortion rhetoric. So the idea that this absurd standard is suddenly golden when it comes to trans people is discriminatory by design. Sad fact is, trans people are being gaslit day in, day out by society. Dawn herself just demanded that trans people be 100% certain of the future before they're given their medical autonomy, an impossible standard meant to undermine a person's confidence in their ability to comprehend how they feel. We are constantly having our thoughts, feelings, and motives challenged by people who flat out refuse to accept an answer that doesn't feed their prejudice, and doctors are not immune to that. If you have a doctor that is constantly questioning your ability to self-declare your current emotional state simply because you are trans, that is a problem. That is gaslighting. It's shit like this that results in trans broken arm syndrome, a phenomenon in which doctors assume every ailment a trans person has is a result of how they identify. Therapy is not a live debate. It's not a back and forth with cheap point scoring. It's about a doctor working alongside their patient to make sure they are equipped to make certain decisions in life. The fact that Dawn seems to believe otherwise suggests, at best, that she's gained her understanding of what therapy is like from TV shows and movies. And while said antagonism between patient and therapist can be a great tool for storytelling, allowing a lot of ground to be covered in a relatively short time, whilst also adding tension to the plot, these are not realistic depictions. A therapist should not be antagonistic towards their patient. It's not their job to dominate, it's their job to guide. Trying to force someone to be what you want them to be is abusive. It doesn't cease to be abusive just because a therapist does it. So thankfully, Dawn is not the arbiter of mental health services or training. However, that doesn't stop her from continuing to lie, as seen here.
The idea that you shouldn't really be questioning someone's gender, whether they say that they are trigender, moon gender, man, woman, whatever. If someone says it, then that's it. And we know that this is a common trans idea. When you have people like this who say they are women, and you must accept them as a woman simply because they say so, you can't ask any questions about it. That all comes from the affirmation model, because all you're doing is you're simply just agreeing with what the person who's told you this, which is obscene. And yes, I know I used an extreme example there, but I think I'm perfectly in the right to do so when that is the kind of end point of this weird idea that they have. If you can't question anyone about their gender, why do you think that they will have absolutely any kind of scrutiny when it comes to a child transitioning? If a child says that they are a boy or a girl, then you have to listen to them. That's what affirmation means.
At its core, the affirmation model is child-led exploration. It is giving a child a secure environment to explore themselves via social transition, so pronouns, style of dress, that sort of thing, to help them be the most comfortable version of themselves possible. If one day they decide to go by her and wear a dress, that's fine. If another day they decide to go by him and wear a dress, equally fine. If they then decide they just want to wear a dress and go by neither her nor him, guess what? That's fine. That is literally all it involves, allowing a child to explore themselves safely. Now, Dawn has conflated this specific model with two other things, the first of which is treating others with basic human decency. Yes, Respecting other trans people, regardless of how they look or act, is affirming them. But that does not make it part of the affirmation model, which comes with very specific guidelines in how to approach gender variant youth. This conflation of affirmation and the affirmation model simply allows Dawn to throw a lot of unrelated subjects into a pile to demonize them all at once. Paradoxically, Dawn also conflates being trans with surgery, an artifact of her internalized transphobia. Affirming gender does not mean they need to medically transition, since you don't have to medically transition in order to be trans. Trans people can transition in 3 different ways: social, legal, and medical. Social transition includes things such as names, pronouns, and expression. Legal transition includes your official documents, so passports, birth certificates, and driver's license. Lastly, medical transition includes the medical processes someone has undergone, such as HRT and surgery. Now, a trans person doesn't have to do any of this in order to be trans. All they have to do is acknowledge their gender. Because yes, a closeted trans person is still a trans person. Whether they socially, legally, or medically transition is a very personal decision, one that takes into account a multitude of factors, including a person's safety in coming out. Dawn, however, does not agree with this. She is a trans medicalist. That is, she believes a trans person must suffer body dysphoria and undergo medical procedures to alleviate that. That's why she routinely does the whole, "look at this non-assimilating trans person, aren't they terrible?" as a cheap means of getting a knee-jerk response from her audience. So when someone talks about affirming trans youth, Dawn is led by her own notion of what being trans means to the idea that the affirmation model is inherently medicalized. Therefore, those who go onto puberty blockers must understand HRT and surgery because of course they're going to go onto those things. Which just isn't the case, and is why approval for puberty blockers is not approval for HRT or surgery. That is why when a person becomes 16 and 18 years of age, they will receive a separate assessment to undergo said medical processes, because that is what blockers are for. Fact is, if a young person actually understood HRT and surgery in line with the standard of Gillick competence, the logical conclusion from that is not to put them on blockers, but to allow them to start HRT and surgery. Dawn's hostility towards those who don't medically transition is a massive irony at the heart of this case. Why? Because qualifying the legitimacy of a person's transness by how they look and whether they've undergone surgery and HRT is an excellent way to pressure them into undergoing procedures that aren't right for them. That is the sickening result of the gospel of the trans assimilationist prosperity. However, no Rosa Dawn video would be fulfilled without an attempt to drag the dreaded trans rights activists.
And then you have some of the really bizarre takes that came from the trans community as a result of all this. You had mermaids pointing out that you have to do this, otherwise plenty of trans kids are going to kill themselves, which, is really like an abuser. That's an abuser's narrative there. Or one of the more bizarre ones coming from Zinnia Jones. Just about 2 weeks ago, Zinnia actually made a fairly bizarre tweet on putting everyone on blockers, saying an inability to offer informed consent to understand the long-term consequences is actually an argument for putting every single cis and trans person on puberty blockers until they acquire that ability. So really, that's, first of all, blatant biology denial. You can't argue that. You're saying that someone's own natural function, everyone's natural function, needs to be stopped simply because a very, very small minority might not identify in that way. That's insane. That's absolutely insane.
I will agree with Dawn that this is an absurd standard. But this isn't Zinnia's standard. It's Dawn's. It was Keira Bell, who Dawn has spent the whole time lauding, who argued that all trans people below the age of 16 should be barred from puberty blockers on the off chance that a few may regret taking them. All Zinnia has done is turn your own logic back on you. It's absurd precisely because it's your standard, a standard which never should have been used as the basis for a high court ruling. And yet here we are. Except the regret Dawn is harping on about is so rare that it can't be measured. So at least Zinnia's position actually has merit behind it. As for being biology denial, what the hell does that even mean in this context? I guess Dawn could argue that putting children on puberty blockers is different to letting a child's natural hormones run their course, but that would be what we term a naturalistic fallacy, the idea that nature knows best. By the very same logic, cancer should be allowed to run its course since it too is part of the natural body. I mean, puberty blockers were developed for cis children undergoing precocious puberty to spare them the psychological anguish that often results in. So their whole existence is predicated on fixing problems caused by a person's natural body. All Dawn is doing here is falling back on the same arguments as anti-vaxxers who cry that vaccines aren't natural. As for mermaids falling back on a quote, abuser's narrative, end quote, in bringing up attempted suicide rates, allow me to respond based on my personal experience as a survivor of domestic abuse and my research into the topic. Bringing up suicide and self-harm is not an abuser's narrative, at least not inherently. Wielding suicide and self-harm as a means of avoiding any and all accountability is what an abuser does. It's a method of disarming the victim, locking them in a cycle of abuse. For this to happen, said trans teens would have to be accused of some sort of crime or transgression, which they're not. They're the innocent bystanders being targeted. So it's fucking disgusting for you to exploit abuse discourse like this to deflect from the harm your bigoted agenda is causing. By declaring discussion of suicide an abuser's narrative, period, Dawn has effectively closed off a large part of mental health advocacy. Now, not only is this something I've been accused of in my line of work, it's something I've been accused of by someone who actually went ahead and did just that. They used self-harm to silence criticism. But what's really interesting about that case is the fact that Rosa Dawn openly supported them. Now I have a lot more to say on that, far too much to fit in this video, and maybe I'll do a full video doing just that in future, but I just wanted to give a quick refutation for now. Thankfully, all that's left for us to deal with is Dawn's conclusion, which, like the rest of her video, is thoroughly detached from what we can observe.
What's more, I think that the people who push for this need to have more of an understanding as well, that maybe just because somebody says their agenda doesn't make that so. Just because people are being put on puberty blockers now doesn't mean that they're going to stay transitioned for the rest of their life, because again, there's simply not enough data on that. Right now, it's a real experimental treatment. Let's treat it as such and not pretend it's just fact.
As is hopefully clear by now, Dawn's conclusion is flat-out projection on her behalf. Not only does she lack any and all scientific and medical basis for her arguments, but she pretends like the opposite is true. The only basis she has for calling said methods experimental are the opinions of untrained judges. Everything else is just hot air by this point. Which shows us that when Rosa Dawn says we need to be skeptical, she's referring to the same inverted idea of skepticism as used by young Earth creationists, 9/11 truthers, and anti-vaxxers. A form of toxic skepticism that rejects any and all evidence that challenges the conspiracy theorist's preconceived conclusion. That's not actual skepticism, that's just willful and malicious ignorance. That's why she has to refer back to non-peer-reviewed books that fly in the face of all available evidence, as opposed to actual studies to support her arguments, like those I've used in abundance throughout this video. The only study she used was the one on puberty blockers, and she only did that so she could pretend correlation equals causation. So I hope this video has helped you understand just how dishonest Rosa Dawn is when it comes to the topics she covers in her videos. This is not the exception. This is the rule for her work. This is how she gets paid. By lying to her viewers. There is no justification for the lies presented throughout this video. None at all. She's not mistaken, she's not naive. She's malicious in her intent. And now you know. If you have any questions or criticisms, do post below. Just know that abuse won't make it through. If you appreciate what we do here on the channel, do know that you can support us via Patreon. We no longer monetize our videos, meaning that Patreon is the sole source of income for the channel, allowing us to keep it running. On that note, we'd just like to thank the following patrons: Hannah Banghart, Matthew Kovac, Soraya and Katie, Garrett Van Vorst, Steve Corbin, Sosh Daniels, and Justin Allen. And for myself, Adita and Levi, take care now.